Absheni, nami amukela eka rihanyo la Dr Pru ezempilo zwamutakalo. Namuhla sikhuluma ngodaba olubaluleke kakhulu kubo babi, umdlavuza ocommon okubizwa ngokuthi iprostate cancer. Kanti njengenjwayelo angihambi ngedwa, ngihamba na Dr Mthombeni ozosichazela kabanzi ngalesi sifo. Ngibamukele Dr Mthombeni.
Thank you, Dokotela. Thank you for inviting me in your show.
Uma ungamtshela umbukeli osekhaya, yimani Dr Mthombeni?
Okay, so Dokotela Mthombeni, vito ra me Joseph Mthombeni, nkulele eMkhuhlu, which is just outside Hazyview here in Mpumalanga. So I grew up there. I studied medicine. So I studied medicine in Medunsa for 6 years. And then I got my qualification of Bachelor of Medicine and Bachelor of Surgery in 2013. And then after that, I had to do my compulsory internship, which is 2 years. I did it at Temba Hospital, also here in Mpumalanga. And that was followed by community service that I did at Rob Ferreira, where I met you. And then after that, I decided again to go and study further. So I went on to do radiation oncology at the University of Free State from 2017. So I qualified as a radiation oncologist from the University of the Free State. I have a master's in medicine in radiation oncology, as well as a fellowship from the Colleges of Medicine of South Africa in radiation oncology.
Wow. So Dr. Mthombeni, mau count nje from your undergraduate and then to this radiation oncologist. Kuthathe iminyaka emingakanani?
So you have to do that 6 years, which is depending on the university that you decide to enroll in to study medicine. So it can be anything from 5 to 7 years of undergraduate full-time studies, and then followed by the compulsory 3 years of internship and community service. And then for radiation oncology, it's 4 years of registrar time of full-time training as a specialist. And then in the 4th year, that's when we write the final board exams.
Mbukele ekhaya, uma ngabe ukhona umntwana wakho ozimisele ukufundela ubudokotela obufana naye abodokotela Mthombeni, Soweto TV sikulethela bona ukuze uwazi kabanzi ngabo ukuthi bafunda kanjani, bathatha isikhathi esingakanani. Kanti ungabobheka iminyaka ngoba lokhu kuyashesha kakhulu, ungafunda nje isikhathi ngokuphazima kweso sesidlulile. Dokotela Mthombeni, asingene endabeni.
Yebo.
Siyazi ukuthi lihlo lisebenza ukubona, indlebe isebenza ukuzwa. Prostate, yini umsebenzi weprostate kahle hle?
Oh, okay. So a prostate, just to the viewers, ekhaya, a prostate it's a gland, ne? So gune urinary bladder le bamba mchamo, and then below the bladder gune prostate. So it's only found kubantu besilisa in men only. So the function of the prostate is that it produces a certain product, ne? Which is a moisturizer in a way that lubricates the semen. So in that way, meaning that ilona, when umuntu wesilisa produces semen, it's able to travel nicely because the prostate releases, that product that helps with the lubrication. You understand? So unfortunately, a prostate, as umuntu akula, it can also enlarge. And then it can also become cancerous. You understand? So that is the main problem that these men actually encounter with increasing age. So it's something that with today's topic rather, being prostate cancer, this type of disease, like a disease of elderly men, seeing in the late 60s and early 70s.
Yazi ukuthi thina abantu understand masithi cancer. Kusuke kwenzakalani kahle hle masisithi kunomdlavuza kune cancer ku prostate, kusuke kwenzakalani?
Okay. So umuntu is made of cells, and it's know that cells, everything like from head to toe is made of cell. Even the prostate itself now, it's made of cells. So lama prostate cells lawo as it happens ukuthi they keep on, because our cells they replicate, meaning that they divide, and then as they divide, depending on where it is, like where they divide, they either grow or replenish. For example, cells on the skin, when they divide, they replenish the skin. And then prostate cells, if they keep on growing and keep on dividing abnormally, in a sense that it cannot be controlled, we call that cancer. You understand? So because those cells makakhula kakhulu, and it's an anatomical structure, they destroy the prostate itself and also the surrounding areas, and also they also destroy my blood vessels. Ngoba prostate now it's surrounded by things like blood vessels. So when those things happen, when that growth keep on happening, lama cells, they can be spread corner lapart to the surrounding structures, or through the destroyed blood vessels to the bloodstream, and also spread to other areas of the body. So it's basically your body overgrowing something, and then it attacks you, and then my role is to basically stop that.
Manje dokotela, uma sikhuluma ngomdlavuza i-cancer, abantu abaningi aba-understand ukuthi kusuke sekwenzakalani kahle hle mase sithi umuntu kune-cancer.
Okay, so cancer, dokotela, it's basically as you know, ukuthi umzimba is made out of muscles. I get. So muscles, they divide, and then maka divide lapho, like they are regulated ukuthi a divide kanjani, and then they can divide to a certain level. So cancer is basically those muscles wherever, depending on where the cancer is starting from. For example, in the prostate, like we're talking now, those cells can divide rapidly, and that process of regulating the cell growth is not there. So it keeps on dividing, and then guba with a growth, and then when that growth happens, it destroys the surrounding structures. The cancer can spread through the destroyed blood vessels, and actually iochala on different areas, including the spine, the bone. Basically, that's where it goes to in most cases. It can also spread to the brain, the lungs, and the liver as well.
Asibambe lapho Dr Mthombeni. Mbukeli lapha ekhaya, ungayi kude, siyaqhubeka nodaba lethu, sisaya etiyeni.